everybody. We are back. The light we hold, collaboration between Shaking in My Boots, me, and Brent, aka Held Light. I hope that you are all enjoying this podcast. We are now on episode 3, where we were going to talk about intimacy. And I was thinking to talk about, frankly, death. But I think that we're going to pivot a little bit and talk about something that all of us could, I think, use a little bit more insight into, which is hospice, home health care, and palliative care. I'm just for people that don't know me, my background was as a hospital administrator. And I actually met my husband at a home healthcare agency that he was the pharmacy director of, and I was a marketing rep of back in the day. So I've been inside the healthcare system and also a utilizer of it as a patient. But also, my father, when he passed away, was on hospice, and I learned a lot in a short period of time. I think there's a lot of stigma around that word. And I'm actually on a new, involved in a new study that has to do with Parkinson's and palliative care. And I think people don't really understand that either. And Brent is living it. So maybe
Hey,
you should start the ball rolling
so I'll just do
with
the
this one.
disclaimer. So what we're about to get into, every state is different. Every healthcare plan is different. Not everybody's on the same. I'm on a healthcare plan through my federal job. Not everybody has the same plan. Not everybody lives in the same state. So I want to throw out that disclaimer. And so always consult with. I can't stress the importance of a good social worker when it comes to this discussion. So yes, my wife has had Parkinson's for 18 years. I've been taking care of her. I mean, she was diagnosed not too long after we got married, right after our son was born. And about 3 years ago, it's weird because I'm losing track of days and time and years and events. But I want to say about 3 or 4 years ago is when we started looking into the hospice type stuff. And she is currently on hospice through my I'm a federal employee, so I have a Florida federal blue plan with Blue Cross Blue Shield, and they're the ones that kind of drove us to let's get her on hospice. She's in that gray area of palliative care and hospice care, and there's some very specific rules that go into that. In addition to that, though, I also was able to get her. She's too young for Medicare. And she doesn't have enough points to collect Social Security disability income. That's a whole different discussion. So I hired a lawyer, an elder care lawyer, and we were able to win a Medicaid case with the state of Florida. So she's able to get most all of her in-home health aid, the home health aid that comes in is through Medicaid, through Humana, through the state of Florida, and they are way underpaid. But the doctor, the nurse, and the all the medications, all the actual medical care is through my private insurance through my employer. And so I'm actually really blessed, but it took a long time to figure this out. And I'll punt it back to you if you. A lot of people don't understand the difference between palliative care and hospice care, and a lot of people don't understand the difference between Medicaid and Medicare.
Yeah, so the hospital administrator and me will take over now. Pass the mic. So, palliative care is something that really everyone with Parkinson's is already in, whether they know it or not, because we have no disease modifying treatment. Everything that is we're doing with Parkinson's is palliative care, right? That's just kind of the nature of the condition, unfortunately. I feel like people bristle at it because they think it means that there's no hope, right? Or, it's kind of this end game. But really, what it is it enables the system to provide what we should already have, which is a kind of an interdisciplinary care approach in a more efficient way. Okay. So, ideally, you would always have the intervention of a social worker, the intervention of of a nurse to help with your wife's meds, or me to help with my meds, a physical therapist, whatever medication that we need. If I need some medication at home or some care at home, that would be all part of our care. But that's just not how our system is set up. Palliative care is that approach. And so I think that's sort of kind of the crux of it. I don't know if you want to, speak about, how that looked like when you entered it.
Yeah. So when we moved to Florida, we talk about our origin stories in the first episode. But when we moved to Florida, we moved here with the known that Florida has a better in-state healthcare system, especially for somebody like me who's a federal employee. And when we got here, I was able to work. I was able to travel for my job, but it got to a point where my wife could not take care of herself anymore. And at the time, my kids were very young. I remember, I think we talked about this in the last story, where my son's like, "Dad, Mom can't drive." And he was, so I'm like, how do I have a full-time job, and how do I take care of her at the same time? Because there's a lot of people out there that left their jobs and just live at home, and that's all they do is care for their loved one. And I can't do that. I financially, I already went through bankruptcy, and I already went through a foreclosure, and I just needed a way to get the care she needed at home, so I could still hold down a job. And for the longest time, my employer was allowing me to work from home as much as possible. But there were times where that just couldn't happen. What the event that triggered it all is she also has some early signs of dementia. And I can't remember the year. Christian told me the other day, he's like, "Dad, you said 3 years in that last podcast we did on children." He goes, "It's been like 7." So about 5 or 6 years ago, I guess, she started like having delusions, or she wasn't doing well in her mind, and she would get that stare, and she would literally, it was sundowner syndrome is what I'm describing. She would literally get up in the middle of the night, and like 3 a.m. in the morning would walk outside. I'd catch her on the Ring camera. That would be what woke me up. And she was like naked, like would just take off all her, and she had no idea what was going on. And that scared me because I didn't know what was going on with her, and I still had to work the next day. And so I got to the point where I'm like, I don't know what to do. And so this is kind of a crazy story. I literally was at my wit's end. I had I just didn't know where to go with this. So I started cold calling nursing homes, because I work for doctors in my job, and they're like, "Dude, you're going to need to put her in a facility." And we weren't on hospice yet. We weren't on any of those programs yet. So I started cold calling in my local area nursing homes. And what I did is I looked up all the high-end ones. I'm like, okay, this is where all the really rich people put their people, and they're not cheap. I think I saw one that was like $10,000 a month or something.
Yeah, they're crazy expensive. Yeah.
Yeah, and I'm like, all right, if it's the high-end one, they probably have top-of-the-line social workers. So I started cold calling. And there's one down the street from us. It's a really nice one. I got a hold of the social worker there, and I literally cried over the phone to her. I said, "Listen, this is who I am. I live very close to you. There's no way in hell I can afford what you guys have there, but I don't know what to do. Tell me what to do." And she said, I forget her name. It was like Rose. It was a flower's name. And she said, "Listen, baby, you need to call this lawyer right here." And so she gave me the name of a lawyer that was literally down the street. I'd never heard of an elder care lawyer before. Didn't know what that was. And she kind of directed me to go to this elder care lawyer. I called the guy. They do estate law and all that stuff, family law. But the good news about this particular lawyer is his mother had Parkinson's disease. So he understood the disease process, and he understood kind of what I was going to go through. And he said, "Listen, you need to get her. Who's your employer?" I told him who I work for. I told him who my insurance was. He's like, "Dude, you need to get her on a hospice." And he walked that dog for me. And then he goes, "We're going to put her on. We're going to try to get her." So I was denied. Let me backpedal a little bit. We were denied Social Security disability income multiple times. So actually, the third lawyer's like, "You don't have a winnable case," because she was a professional student and working part-time. She didn't pay enough points. She stopped working like 10 plus years prior to us applying. So that was a non-starter. And then the lawyer's like, well, that's Medicare. Who cares about that? You need to get Medicaid through the state, because what you need is not income. Because I make decent enough money. He's like, you don't need the income. You need the in-home health aides. And so he was the first person to explain to me the difference between Medicaid and Medicare. And so he walked me through. There's a whole process to this. So we started with getting her on hospice care through her primary care provider. He 100% agreed. Like, yes, this is the way to go. We started with one hospice company. We moved over to another one, and we're very happy with that company, that organization. And then at the same time, we worked through putting her. It was in a memory care unit. Unfortunately, it was a state-funded memory care unit. It wasn't her most memorable experience, and it was when COVID hit. And so she was in that facility. I think it was 120 days is the magic number that she had to be there. And I don't know all the legalese, but it was to prove that the point was to prove that she cannot be left home alone. I have a job, and I needed to work, and I couldn't quit my job because that's where my healthcare plan comes from. So long story short, I cold called social workers, because as a paramedic who's worked in the ER, I'm like, I know social workers are like the ones who have all the answers if you find a really good one. And I just started calling around until I got one that really took the time for me. And then she passed me off to this lawyer, and he brought me in, sat me down, said, this is what we're going to do. By the way, he wasn't cheap. I want to say it was $7,000. And that was the first or second time I swallowed my ego, and we did a GoFundMe, raised the money, and I was able to pay for the lawyer. And I want to say it was 6 months to 9 months later, she's now in hospice through my employer's insurance plan through the Blue Cross Blue Shield, and she's collecting Medicaid, or she's getting Medicaid in-home health aid service through Humana via the state of Florida. And that's how we got to where we're at. And I'll be honest, and this has been going on about 3, maybe 3.5 years now. And if it wasn't for this, I would be bankrupt. Or I would have had to quit my job and figure out a way to live off of because I do have a VA disability rating, which is helpful as well, but there's no way I could just live off of that. Like I have a lot of followers on my platform that are living at home, living off of Social Security disability income or Social Security benefits because they're old enough to collect that, or living off of some sort of disability, Social Security disability income, while taking care of their loved one. And it breaks my heart. Like, I'm very fortunate what I have, but it took me a long time to figure this system out. And it took me being persistent and not taking no for an answer. And then finding a lawyer who knew what the hell he was doing and just trusting the process and letting him guide me through it.
Yeah, and you're able to keep her in your home with this. And then I know when I first met you, you were on a work trip, and she was in respite care. So maybe you want to just explain respite.
Yeah. So with respite care, my health insurance plan through hospice care does allow respite, and it's 5 nights, and I can't remember if it's every quarter or if it's like, okay, once you use it, you can't use it again for 90 days, or if it's like every quarter you get it. I know I can't back them up. I can't do the end of one quarter and the beginning of the other and get my 10. And the social worker is the one who works all that, and we have a phenomenal social worker through our local provider. I also get respite care through Humana, or through the home health care company that takes. So Humana is the prime, and then they subcontract. And that's, and I can't remember the number of hours. It's a Florida law, or I don't know if it's the same in all the other states, but it's a number of hours. And I'm going to make up a number. I don't know if this is right, so don't fact check me on this, or do fact check me. I think it's a couple hundred hours that you get per year that you can use in addition to. So for example, there's been times where I've had to work like a 10-hour day or a 12-hour day because my job it gets busy and then it slows down. And I'll ask for, hey, can I get 4 extra hours of care on a Monday so that I can work late? And as long as I pre-coordinate that far enough in advance, it's got to get approval. It's got to go through a process. I've never been denied, but I can get additional hours in the house in addition to putting her in respite, the facility where she can stay for a few nights. I use the respite for the facilities so that I can travel for my work when I need to, and I use the in-home health through the Medicaid through Humana for when I have a longer work week or something going on that might take up my day.
Yeah. So just to kind of backtrack a little bit, Medicare is a federal program that is most known for being what we get over the age of 65. So that's like the insurance that we get if we're over 65. But there's exceptions to that. So people that are disabled, people that have certain chronic conditions can qualify for Medicare early. If she had gotten actual SSDI, if she had gotten on disability, my understanding, and again, don't quote me on this, is that you automatically get Medicare a year after you get disability. I think somebody some people have told me that. But again, it just depends, and the process is notoriously difficult and different for everyone. I know people that have gotten approved on their first shot that really I wouldn't have even thought we were going to get approved. And then I know people that are completely disabled who have gotten denied multiple times. You can do all this stuff yourself, but it's also 50-50. Some people tell me, like, just get a lawyer. And some people, again, are like, oh, I filled it out myself online and I got it 3 months later. A lot of that does have to do, again, with what state you live in, because even though these are federal programs, they're usually administered by the states. And so Medicaid is also another federal program, but it is 100% administered by the state. So and we know that just varies so wildly as to what state you're in, what level of care and coverage you get. The good thing about Medicaid is once you get it, it is kind of known in the healthcare field, at least, as being basically all inclusive. But with Medicare, the main issue is some providers just opt out, and that's really not anything that anybody can do about. I know I have followers that all the time reach out to me and they're like, that my doctor's not taking Medicare anymore, blah, 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 blah. And then they're scrambling. So, it's a broken system all around, but there is what you're saying about the social worker is so important. So the last job that I had was at an FQHC, a federally qualified health center. These are federally funded primary care sites that exist primarily in underserved areas, but all over the country. And they're really great because they're one-stop shops. So you can get your primary care, but they also have social workers, benefit coordinators, mental health services, pharmacy, radiology, all of these things under one roof. It is income-based, but I always recommend that as like a first place that people go. Depending on where you live, of course, like everything, there might be a wait time, but that was a place that I really, really loved to work because seeing that real coordination between who should be on your team was really great. The reality is, for most people, they don't have a team.
For me, it was. I remember the lawyer breaking it down for me, in because we had to do some things. We had to, because this is the advice that I got early on in my process. Because I did start a platform that I ended up shutting down. I made a YouTube video that went a little bit nuts because Heather, the Parkinson's advocate that Trudy follows way back in the day.
Heather Kennedy.
Yep, Heather
That's my girl.
Yeah, she saw my video and she's like, "You are amazing, and this needs to be heard." And she shared it, and then it blew up. And then I got a bunch of comments, and I'm like, "I'm not ready for this," and I deleted it. That was like at the very beginning of my journey on this. And what I did is I ranted about, make this make sense. I actually called out the local congressman. I'm like, make this make sense. I've served my country. I've got a disability rating for my service served. My wife was a professor. She's worked most of her career, but mostly part-time. I've paid a ton of taxes into the system over the years, and we were getting denied Social Security disability income. Like, make this make sense. Like, this doesn't make sense, and then when I fast forward and I got to the lawyer, he's like, "Look, dude, you're focusing on the wrong thing. You were going after Medicare and Social Security disability income. Your wife is too young. She didn't pay enough into the system." And he tried to break that down. And he goes, "Medicaid is a different thing. It's income based, and then based on her needs and her income." And so, like, back to my point, people in the beginning were like, "Oh, just get a divorce. And then if you divorce her, then she qualifies for all this stuff." And I'm like, "Are you fucking kidding me? Like, no, fuck you. That's the dumbest fucking advice I ever got." Sorry, I'm going to cuss on this one.
A lot of people do that, though, out of desperation because they don't understand the system.
I just think it's fucked up because if I did divorce her, I wouldn't be able to claim her on my health insurance policy because she wouldn't be my spouse. And I wouldn't be able to claim her through the VA once I get to that point. Like, when people would say that to me, and I'm sorry for anybody that hears this or watches this that has done that, I'm really sorry that you did that, but I'm not going to do that out of pure freaking spite. I'm going to, no, just for me, that was a hard pass. So again, when I got the lawyer, he's like, "No, you don't have to do that. What we got to do," and we ended up, I forget all the paperwork we did but he separated all of our assets. Like, because the house that we live in, it's in my name, not her name. The cars are in my name, not her name. So we separated all the assets. She cannot be on the same bank account as me. She has her own account, and there's a certain amount of money that she's limited to having, and she's not bringing in any income. Zero. She's bringing in zero income. She hasn't brought in any income in the last 15 years. So it's all on my income and on my insurance policy. And so, again, I don't know how he did it, but I just trusted his process. He wasn't cheap, but a GoFundMe got me to where I needed to go. And so with Medicare, that's based on your age. That is through the federal government, through their Social Security disability, through your Social Security. Medicaid is through the state. But here's the part that the video that you're referencing earlier on. I've made 2 videos on this about CNAs and in-home health aides. So it's bullshit how much they get paid. Like, total
it's notorious.
bullshit.
In the healthcare system, they are literally the most overworked. They do absolutely the work that nobody else wants to do, and they make less than a Starbucks barista. It's
100%. 100%. My oldest son was working at Starbucks, and he was talking to the lady that used to care for my wife at the time. He made way more money than she did. It's total bullshit how much they get paid. And here's where it gets controversial on some of my comments on the different platforms is, so your taxpayer money goes from the federal government to the state. The state's going to take a cut. And then the state is going to send the money, in our case, to Humana. And Humana is going to take a cut. And then Humana is going to send it to the company that actually provides the caregiver, and they're going to take a cut. And then the caregiver, the in-home health aide that walks through the door, is an independent contractor to that company, and she gets paid. It's bullshit. I think they're making like $15 an hour right now, and that is not enough for what they do. The system is broken in the sense that, I'm no congressman, and I don't think they even give a shit, to be honest with you. But how do you get them paid more? So what people will tell you is, "Oh, well, then just go with when I make these comments, I'll get blown up with comments like, 'Oh, just hire a private company.'" Of course, if you hire a private company, they're going to pay them $26+ an hour, and you're going to get a little bit different service. I don't make that kind of money. Like, I'm not the one pay. I need this program that is state funded or federally funded through the state to pay for it, or I'm going to go bankrupt. And oh, by the way, I can't stand it when people talk about, "Well, go with the private company. They have better aides." Fuck you. The services that we've been getting have been incredible. Maybe it's because of where I live. Maybe it's because it's the state I'm in and the county I'm in. There's a lot of old people, and there's a lot of folks that have in-home health aides. But these in-home health aides, like my wife has 2 right now that take care of her through Medicaid. One is here Monday through Thursday. The other one is here on a Friday. The one that's here Monday through Thursday is absolutely incredible. She's been with Trudy for over a year now. She knows my wife better than I do. She's the one that says, Brent, these meds are, she's the one that identified some of the dyskinesias earlier than I did. And I mean, she's family to us. And then the one that comes every Friday. So the one is much older. Well, they're about the same age. So it's almost like Trudy's got a sister taking care of her, an older sister who's taking care of her. And the one that comes on Friday is young. She's in her early 20s. She's actually amazing. She's from Paris. She's trying to go to nursing school, and she takes care of my wife. Not just my wife. She has several other patients that she sees. And it's like having a daughter here to take care of her mother. So they are absolutely hands down incredibly good people who are so attentive to her needs, and it's insulting what they get paid, and I don't know how to fix that. I don't know if there's a way to fix that, but I am just so thankful that they exist, and I'm so thankful that I hired that lawyer. Let me backpedal. I'm so thankful that and this is fucked up, I was at my wit's end. I didn't know what to do. I had nowhere else to go. And I just started cold calling nursing homes until I found a social worker who was willing to listen to me, because previous ones were like, hey, sorry, if you're not in our facility, I can't help you. And I had one lady who just, Rose, I believe was her name, just took her time and she said, go here. And I had to just like let go and trust the process and suck up my pride and do a GoFundMe to raise money to pay for this lawyer. But that once we did that saved my ass. Because like I said, I went bankrupt and we foreclosed on a house in New Mexico because bubble burst. We couldn't sell the house, and I went bankrupt because I was paying out of pocket for everything. And now I'm not.
I mean, so I mentioned to you before we decided to go with this topic that before my father passed, he went on hospice, and that was kind of a crash course for me on what that looked like. So kind of to reiterate what we're talking about when we talk about why all Parkinson's care is palliative care, is because, spoiler alert, we're not getting cured of Parkinson's, okay? It is not something that is going away. Okay. So unlike if I got home health care for, an infection in my knee, or I needed physical therapy post back surgery, you have to look at things from the perspective of what we call your payer source. So insurance, who's paying. And that's how what the healthcare system is built around. So when you're talking about a condition like dementia or Parkinson's or Alzheimer's, it's not like some forms of cancer where you're going to need a care for this period of time until your condition resolves. Parkinson's is not getting resolved, okay? So that makes all of our care palliative until we get some kind of something that can slow progression, which we all want, but we just don't have. And so that's why then it becomes like, how is the system going to help you live with this condition for however long that you're going to live with it, which is the rest of your life, And I think that's why younger people with Parkinson's in particular are hesitant to even crack the egg on that, because in their mind, that's sort of setting you on this path, right, to an end that we don't want to think about. But it's not about the end. It's about the journey. It's about the care that you get along the way, however long it is, Now, what I learned with my dad with hospice was my dad was very fortunate because my stepsister was and his second wife, my stepmother who raised me, were his care partner. And she was and is a nurse. And so she also knew the system very well. And she also was the care partner for her father and stepmother. So she had her hands full. And she called me one day and she said, I just wanted to let you know that we put dad on hospice. But she's like, don't worry. She's like, it has nothing to do with like dad's going to die tomorrow.
100%.
She's like, this is because mom needs help. She's like, this is so. Yeah.
When I advertised that I was putting her on hospice, people are like, "Oh, is she going to die? Do I need to come out there?" And no. Yeah. So just because you get on hospice doesn't mean you're quitting and you're giving up. It's a system in place to help you, and she's been on it for 3.5 years. right? And she's getting incredible care. Now, every 6 months or so, they have to reevaluate her. There are some guidelines, and I don't know them off the top of my head, but there are some very specific guidelines that she has criteria that she has to meet to be on it. And she's on it, and she unfortunately, there is a slow decline, and so she continues to requalify for it. I went as far as to find early in this process who the approving authority was for my insurance company. And I found who they were. They're in Jacksonville, Florida through Blue Cross Blue Shield. I talked to them and like, yes, this is how the process works. Yes, your lawyer is advising you very well. Yes, you have a good healthcare plan. She's the one that said, don't quit your job because you got the best, being a federal employee, best, you're good. Like stay where you're at. And she's like, we won't deny you as long as they keep filling out the paperwork appropriately, and unfortunately, as long as she continues to trend downwardly, like we're going to continue to support her. You're not quitting on your family member. They're not. People think of hospice for like, okay, they've got cancer and they're going to die in a few months. Yes, that's there too, and yes, there are patients that need it for that as well. But when it comes to these degenerative diseases like Parkinson's and dementia and others, you can qualify for it. You're not quitting. You're not giving up. It's not a death sentence, and
Yes,
and
100%.
it's getting a bad rap, and just stop it.
Yeah, yeah. It really made me, because I was exactly the same way. I mean, she called me and I was like that. I was like, oh my gosh, like, do I need to fly out? Like, what's going on? And she's like, no. She said, this is enabling us to, we got him a hospital bed. The nurse is going to come, X amount of days a week. There's a lady that's going to help with to bathe him and with the housework. And it's just going to make everything a lot more easy. And again, Medicare is going to pick up the bill for these extra services. And it ended up, my father actually did pass fairly soon after that. But when I did go out and see my mom, for example, did get respite care when she needed a break, which was super important for her because she had been taking care of him for so many years. And I felt like that was a real blessing to her, to be able to feel comfortable. My I call it, I mean, I use this term stepmom very loosely because she raised me, and she is my mom as much as the woman that gave birth to me is my mom, so, but she was very particular about her home and who took care of my father. My father was a surgeon. He was a physician himself, and his absolute one wish in this world was that he die at home, that he not die in a hospital, because he worked in hospitals all his life, as did I. And he wanted to die at home, and however that looked like, he wanted to be home. And he had very strong do not resuscitate, advanced directives, living wills, that, he have no interventions. When he goes, he goes. He did, and that was a decision that he made early in his life so that that decision didn't go on his loved ones. And he was able to have his say when he was cognitively intact. And I recommend everyone, I do not care how old you are, to sit down and have that discussion and put it in writing, because life comes at you fast. And it doesn't have anything to do with Parkinson's. That's just how life is. And it just makes it easier for everyone. But to have my dad there at home and see how those hospice nurses were with him was absolutely beautiful. Literally, when my father passed, I was sitting on his hospital bed in his bedroom, holding his hand. The nurse was there. My mom was there. And she was actually talking to us about what the end would look like, like how things to look out for, because he had started to have gurgling when he breathed. Like his breathing was really off, and my mom it was very upsetting to her. And so we kind of had a feeling, me and my sister, but so we asked the nurse, and she was literally explaining, like, okay, the beds of his fingernails will turn purple, blah blah blah. And as she was, I kid you not, Brent, as she was describing it, as she was sitting on the foot of his bed, she took off his socks and she said, the his toes will get cold. And like, as she was describing it, it happened, like
Yeah.
while she was sitting there. And he took his last breath and he was gone, and we were all by his side. And it was the closest thing to a good death as anybody in this world could ask for.
Yeah.
But afterwards, it wasn't like she just was gone, she reached out to all of us months after and checked in. Do you know what I mean?
Yeah.
Like, these people are so compassionate, and really, to do that kind of work, I think you have to have a calling to do that,
Oh yeah, the nurse that she has, so there's a primary nurse that they come every Monday, and then there's a couple that backfill for her, and they know, because she's been with them for so long, they know her so well, and they're so good. And her primary doctor through hospice is incredible as well. And the compassion is the appropriate word, because they see death and dying every day. We've mentioned before, I'm a paramedic. I don't really work as one anymore. I maintain my cards, but I've moonlighted. Every state I ever lived in until I got to Florida, I moonlighted in the emergency room. So I've seen a lot of people take that last breath. My first experience with hospice care was actually Trudy's mom. So when we lived in New Mexico, her mom was, kind of a sad backstory. Trudy's sister died from a very rare form of, I think it was muscular dystrophy. Something with her mitochondria was off. And when Trudy first got symptomatic, we thought it was that issue. It was like a ragged red mitochondrial issue. So we had to go through that rabbit hole first to see if it was that, and it wasn't. And then her mom develops colon cancer and lived not too far from us. And it was it was bad. And so her mom did not want to be put in a nursing home. At the time, we had a big house in a spare bedroom with its own bathroom. And so I'm like, nope, she's going to stay with us. And so they brought in the bed. Her mom lived with us for a few months, and I was right beside her mom when she took her last breath as well. Trudy at the time was helping manage her mom's business that she owned. It was an auto shop that her and her stepdad had together. And that was my first real experience with hospice, because prior to that, I had seen some kind of nightmare stories of patients coming into the ER that were neglected in some of these facilities. So I had this really shitty kind of attitude towards hospice care until Trudy's mom lived with us and passed from cancer. And then I'm like, oh, okay, wait, these people genuinely care, and the way that they handled everything was incredible. And so when we went the route we went for Trudy, I kind of had it in my head like, ugh, the bad juju of, she's like, I'm giving up on her. And I'm telling you that lawyer is like, no, dude, you're not giving up on her at all. Like, this is going to save you financially, and this is what it's in there for. And it's people don't understand that it exists for any illness as long as you qualify, and we do.
Yeah.
So
and
there's
there's two side points that I want to make real fast, which is, one, I too, coming from a healthcare background, because I was, like I said, a risk manager. So you see all of the bad things as a risk manager. All the bad things that happen in hospitals goes through risk management. These home healthcare agencies are businesses like any other business, right? And there's good and bad, and you will meet angels and you will meet devils. And so you always have to be a very, very informed consumer. And as we always like to say, trust and verify. Because, if you're leaving your loved one with someone, I mean, it's kind of like we always say with kids. I always tell my kids, like, if you're somebody that abuses kids, you're going to get a job working with kids. You know what I mean? You're not going to go work with dogs. So you always have to be really aware and careful, listen to reviews, get people to give you their recommendations, your doctors give good recommendations, other patients, people in support groups, stuff like that. But if any of your little spidey senses are off, you need to listen. You need to listen to that voice in your head.
I sat through
that's like super important.
I sat through a TikTok live I was invited to a while back, and they were talking this very issue. And one of the ladies is like, "I put a nanny cam." It's like
Hmm.
they
Oh,
when they drop their loved one off at a respite place. Like I have a nanny cam, and it's on, and it's connected to the Wi-Fi of the facility, and they know they're being watched, and it's legal, and they're totally allowed to do that, and it just gives her peace of mind. The one, so my wife's been to a couple of facilities. The one that she was in for the 6+ months during COVID, that was a terrible, terrible experience because COVID hit and I couldn't see her through. I had to see her through a glass and mask. And we had a worst Christmas ever. Was that time frame? And I won't say the name of it. It's here in my area. It's the people that worked there were phenomenal, but it was state funded. So the building it was in was not. And so it was a really not a nice the facility sucked. And so I've never cried as hard as I did the day that I dropped her off at that place. And this was all part of the plan of getting her, hey man, you got to get her there. You got to do 6 months or 120 days or whatever the number was. And just, this is the way it is. And then of course, COVID hit. And the reason why it broke my heart is she was still pretty far gone. The good news is during her time there is when they figured out, hey, Seroquel kind of brings her back, right? Because I thought she was going to die alone in that facility. And oh, by the way, her father died from COVID with Parkinson's and dementia alone in a care facility in New Mexico. And I'm like, great, this is the way she's going to go out too. Are you fucking kidding me? And I cried. I felt like, this is a bad analogy, but I felt like I dropped my dog off at the pound. I'm like, no. So the good news is I stayed persistent. I visited because they allowed visits, but it was like she could come up to a window and I could see her through the window, and they knew that I was there to see her every day, and I asked lots of questions. I'm like, who's the nurse? I want to talk to the nurse.
oh
Where's the
yeah.
nurse? Yeah, who's the doctor? And then I made sure they all knew that I was a paramedic, and I got great, another one of these, because they're gonna sharpshoot me. But it let them know that I gave a shit and I'm watching.
Yeah.
And then in the end, they were all phenomenal people, just not the best facility in the world. And I promised Trudy after that experience, I'm like, I will never, ever leave you in one of those facilities. You will die in this room, in this house, in that bed. And kind of an interesting story is the house we're in. I didn't want this house. She picked it. I let her pick the house when we were looking to finally move into a smaller place. And she said it the day that she said, this is the one. And I'm like, okay, why this one? She goes, this is the house I'm going to die in. And I'm like, okay, I guess this is the one. So I will never, ever, I mean, I definitely take advantage of respite because if I don't, I fall apart. You have to. And Esther, I hate to tell it to you harsh, but there's going to come a time where your husband's going to need to put you in respite so he can get a break. And you're going to have to be okay with that. And anybody listening to this that has young onset Parkinson's or at that edge, like there's going to be a time where the people caring for you are going to need to put you in respite. And it's going to be heartbreaking and gut wrenching. And Trudy doesn't like it when I do it. Usually after 48 hours, she's crying to get me to come get her. But she sees the person I am after the 5-day break. And she sees how, because I get sleep and I get rest and I get rejuvenated. And oh, by the way, I miss her. And so, it's important to take advantage of it when you can, but I would never, ever leave her in one of those places long term. And that place that we do respite for her hospice care. So when we do the through the health insurance plan, through the hospice program, they have what they call a hospice house where they'll bring her in. It's really nice facility, but it's for short term. It's for respite, or it's where they bring folks in the last day or two. So I can't
Yeah.
say
And
enough about it. It's been great. Hospice has financially saved my ass, but it comes with a bad rap.
yeah, definitely. And I do want to make 2 points. Is one is that you know, we paid for this. You
Yeah,
know,
you're
we
taxpayer.
paid
Have
for
you looked at
this.
how much comes out of your fucking paycheck?
We paid for this. And the fact that people are still ashamed, embarrassed, or reluctant to use the money that they paid into is insane to me. And secondly, as I mentioned before, I don't know what my future looks like. All of our futures look differently. For me, I worry more about, since my husband is so much older than me, that we end up kind of in a dual care partner role, right? And so when I was working during the pandemic, I and in the hospital, you remember when you had to go into the hospital during COVID, like we would take your temperature and
Yeah.
all that junk that was a complete waste of time.
Yeah. You had to
But
going
because
into
we were
any
all,
building.
since we were so understaffed, admin leadership rotated working that table. And so I had a rotation, and I would take the temperature and make sure everybody had a mask and all that stuff. And I was working at a surgical hospital at the time, and so we didn't have long-term patients or an ICU or anything like that. It was like hip replacements and stuff like that, low acuity, we call it. So anyway, but one on the second floor we had a wound care unit, so it was like outpatient wound care. And there was this couple that used to come every week. They were so old and cute and adorable. And the definition of the blind leading the blind, like I think was probably nonverbal, and he was always holding her hand and reassuring her, and just like when you meet those couples, you can just feel the love, you can just feel the compassion.
Yeah.
And he would take her to her wound care appointment and then bring her back, and they would leave every week. And something about that couple just like hit me so hard, because that's the reality for so many people as we age. It's like, okay, at a surgical hospital, when you go in for surgery, you have to have like the emergency contact and who's going to pick you up, right? And so you'd have like this 80-year-old hip replacement surgery. Her pickup was like her 90-year-old husband, you know what I mean? And I'm like, I feel like I don't even feel like this is safe, but that's the reality of so many people. Like, my parents are gone. I don't have family that lives close. My husband is 13 years older than me, knock on wood. But if he gets sick, my children are still not even in high school yet. Like, that's the kind of scenario that I look at more as,
So I have in the military, we call it the go to hell plan. Is if a landslide happens or something really bad happens, what's the go to hell plan? And I learned that from the military. So when she first got diagnosed, and I'm like, all right, what's my go to hell plan? So with my kids at the time, my oldest son, he's my stepson, so I already talked to his dad. He's like, yep, if this all happens, yeah, I'll have to bring him in. And then I talked to my younger brother. I go, dude, you're now his godfather. Like, I had a good living will. And then like dumb shit. Cause unfortunately being a service member, I've lost a lot of friends to war, and I can't tell you how many of them didn't have their shit together. Hey, where's this will? Or, oh, cool, the ex-wife got everything because he didn't change, things, and the girlfriend or new wife, whatever. So when it comes to that, like, let me just say this real quick before I forget about it. When it comes to Medicaid, some states will come back for their money because the state's paying for all of that. Like, you know how you said, hey, we pay for that? Some states, state of Florida, can come and try to reap all the assets back. Like, okay, cool. Grandma passed, and now we're taking her house and we're going to sell it, right? And probate is the magic word there. But there's ways around that. In the state of Florida, you can do what's called a ladybird deed. There's a lady here in Florida, I forget her name, but she posts a ton of content about Medicare, Medicaid, she's an elder care lawyer, and she posts content about it. So there's a way around it. So just so you know, like when grandma or mom or you are on getting all these state funded free handouts, the state can come back and try to get their money back, and they typically do it by grabbing your assets and then selling the assets. So that's why it's important. My point to that is it's super important to have a really good, solid living will, and then anytime I bring this topic up, I get overwhelmed with trust. Put everything in a trust, and that's where these lawyers, that's what they're experts at. And so my go to hell plan, it's actually right here in the office. Since we're talking about it, this little box right here, it's one of those fireproof like boxes, And my son knows that if all hell breaks loose, open that up. I've actually used AI to help me build it's just an instruction guide. It reads like an operating instruction. In there is like passwords to things, how to get to the accounts, how where, and it's got a lock on it. So nobody break into my house and steal all my shit. So, anyway, it's the go to hell plan. It's everything my kids need to know if something were to happen to me right away. If something were to happen to me and my wife at the same, like God forbid we were in a car wreck, right away. I have a really good life insurance policy that I pay a little extra for, but that way, if something were to happen to me before, like if God, and we talked about that in the first episode, my biggest fear is dying before my wife and leaving all that on the kids. So I took out a good insurance policy so there at least be money there to help. And you just have to have a plan. And it's not just, I have a living will. No, dude, like, what's the login to the fucking Wi-Fi of the house? How do I pay the light bill? How do I pay the water bill? Where's the phone bill? Like all those stupid things and I've learned this not from caregiving. I've learned this from my friends who've died in combat or died in training. And then the family is like, I don't even know how he used to pay the mortgage. So
that is so important, Brent. And like as you're saying this, I'm realizing
you don't have a go to hell plan, Esther. Get your shit together.
No, that I do. And then the person that was the person died.
Yeah.
And I didn't update it. So that is everyone's homework from this episode, is to get your go to hell plan together. I started to do this last year with certain things because I started to forget things. And I started to realize that, I am the keeper of all of the memories, of all of the logins, of all of the passwords, of all of the reminders. I pay the mortgage. Well, we don't have a mortgage anymore. I pay the
that must be nice.
I pay the.
I think you just got a bunch of haters.
You're gonna edit that one out.
Nope,
there.
I'm leaving it in.
What do you call it? Property tax.
Yeah.
So I don't know if you've ever had the joy of living in Texas, but I can assure you that my property tax is most people's mortgages, because
Florida's pretty bad too.
Horrible, especially the city that we live in. Even though we're one of the poorest metropolitan areas in Texas, we have one of the highest property taxes. So but I was the one that set up all the auto pays. I was, you know what I mean?
Yeah, and that's exactly it.
Like what if something happens and I forget, and
something stupid like what's the Netflix password and how do I pay the net? Yeah.
Oh, my husband is still texting me once a month, like, what's the Hulu password? I'm like, it's your birthday, dude.
So yeah, it's so important I call it the go to hell plan. That's kind of stems from my military service, and unfortunately I've watched a lot of my friends unfortunately pass due to the 20-year war. But it was he had a will. Cool. Where is it? Who has it?
Yeah.
And he had a 401k. That's great. Whose names were on it? Like I learned this, I was married once before, and I recently got my 100% disability through the VA. So I'm now about 5 months ago, I got 100% total permanent disability through the VA. And I'm now starting to slowly learn all of the benefits that come with that. Unfortunately, the furlough has slowed some things down. But one of the things is like, there's another healthcare program that I might be able to, that I can get my wife on that might help. And I'm like, cool. So I started the process. I went over to the base, the personnel office, and they're like, okay, cool. And they had in that system my ex-wife still. They did not have in that system my wife or my kid for that matter. And they're like, you need to show us your divorce decree and your marriage certificate and your son's birth certificate to change this system. I'm like, holy shit. So you're telling me if I drop dead right now, he's like, yeah, you need to fix this. So that's fixed. The point is I made a binder. Like I said, it's literally like break in case of an emergency. And I've used Chat GPT AI to help me write it. And
This is what I want to talk about. Please. I get
yeah,
so many people in my comments
uh,
that don't understand ChatGPT or are scared of
or
ChatGPT.
Gemini.
Please,
Yeah.
please explain ChatGPT for the viewers at
All
home.
right, so we'll do it right now. I don't know if I can do it on. Well, so I'll do it on my phone here. Watch this. We'll see if this actually works on the magic of podcasting. So I'm going to try to do a voice to text, or I'm going to use. So I pay the $20 a month, and I'm talking
Me
to it.
too.
I'm talking to it right now, and so I'm telling, "Hey GPT, I'm on a podcast right now, and I want you to walk me through a go to hell plan in case I die. What are all the things I should have listed out for my family to know about, and where they are? Just give me the top three."
Absolutely, Brent. I've got you covered. And I know you've been working on a go to hell binder before, so let's keep it straightforward. First, you definitely want to have all your essential legal documents in there. Things like your living will, any powers of attorney, and your actual will. That's number one. Second, have a clear list of all your important financial info, bank accounts, insurance policies, any investments, and where to find them. Basically, so your family isn't scrambling or guessing. And third, include a list of passwords and key contacts. This means login info for important accounts, plus the names and numbers of any professionals they might need to call, like your lawyer, your financial advisor, and so on. These three categories.
You get it. That's
Yep.
that's just on my freaking phone with this.
Yep.
Now you don't have to pay the subscription. I pay the $20 a month because it allows me to upload some stuff, and I've been using it to help me build the held like idea. But that gives you like when I tell people, "Hey, I built a go to hell plan," I'm like, "That's amazing. Where'd you come up with that?" I'm like, "This magic box that sits in my front
Yeah.
pocket."
Yeah, exactly. I use it for everything, and I really feel like, especially for the reminders and things like that, it's just become so integrated into my life, and then it is, you know, a personal assistant
Yeah.
to me. At this point, I've named her, I've changed her voice. Your ChatGPT girl is extremely annoyingly eager that I want to punch her in her
When you
AI
pay the
face.
subscription,
Mine is much more chill, and she's a whole vibe.
yeah, when you pay the subscription, you can give it a personality, and that one's Maple. So and there's times where I'll go, okay, enough. Give me a different voice. I wish they could do it like I really wish they would like monetize Morgan Freeman. I want to be able to talk to Morgan Freeman every day.
Oh, that would be cool. Yeah, they should. They should.
I'm
They
sure
should
that I'm
have like
sure that'll happen.
cameos.
Yeah,
Like
I'm sure there'll
I
eventually be
want
a way
mine
you
to
can
be
pay for
like
it.
Charlize Theron or something
Yeah,
like that. That would be cool.
I want Morgan Freeman. That dude
Or
could.
Oprah. Oprah would be nice.
Oprah's a good voice.
But yeah, I really highly suggest that people not be afraid of it. You do not have to pay for it. It is not going to start the robot revolution and steal all your data and stuff like that. It helps a lot because, like, I only have so much energy for life, and why wouldn't I? My daughter always jokes, she's like, we have all of the information in the world on our fingertips, and what are we doing with it? Nothing.
So,
Nothing useful. So
in
we
addition,
need to use it for good.
I was going to say, in addition to the Go to Hell plan, that is a physical book, and honestly, there's stuff in there that I haven't finished doing. Like, for example, I recently, just because I wanted to try it out, started investing a little bit of money in crypto. I'm like, cool. I need to put in there like, what's my Coinbase login? So he can do that, and it's like $2,000, but it's not like, God forbid there's like a crazy run and that $2,000 turns into millions. But the other thing is we have a computer in this room, so I use my MacBook for what we're doing right now. But then there's another computer in here that's just a standard house laptop. It's just a crappy little Acer that everybody has the login to it, and on there's a folder in there, and it says "Go to Hell," and you open it up, and boom, everything is in there. Everything that's I have it all password protected. I don't put everything in there. Some of that stuff I have printed off because I don't want people to hack my shit. But it's so important that. Here's the take. Kind of the theme of what you're wanting to talk about today on this podcast was young onset Parkinson's patients, or anybody with a younger disease process. That if you're going to get to a point with young onset, I'm sorry, you're going to get to a point where you can't physically do the things you used to do. You're going to get to a point. Go ahead.
But let's rephrase it.
Um,
So we're all going to get to that point. It's called aging.
that's fair.
And that's just the reality of life, like it's just life is a progressive illness. Our bodies are literally rotting around us. So we don't know the specifics or the timelines, but these are things that we have to think about sooner than we probably would have liked to think about them. Just like I had to think about not working a lot sooner than I ever thought. And that's just life with Parkinson's. For those people that work until retirement age with Parkinson's, like, more power to you. But we're all on different timelines. And I think this kind of stuff is so super important because we're all going through it. But I think specifically in young onset, we just have this tendency to put blinders on. And like, we don't want to think about this. We've got all this other stuff going on in our lives. We're just going to keep chugging one day at a time. And I am a firm believer of living in the moment. Really, it's the only way to live. But you still got to plan for the future, y'all.
Yeah,
That's just common sense.
We used to say in the military, proper planning prevents piss poor performance.
Exactly.
So, and that you're right. Like, so I never expected, Trudy to be 53 years old and on hospice care, but I also didn't expect her to not be able to work 3 years into our marriage, So it is what it is. It's a degenerative disease. You're right. Well, I mean, I could drop dead in a car ride tomorrow, but it's okay to say, you know what? Hospice might be a thing for me. CNAs and in-home health aides are phenomenal. You're not giving up. And oh, by the way, if you're getting to the point where you just can't keep up anymore, it's going to help you, the caregiver. If it was not for the care that she's getting through my insurance and through Medicaid, through Humana, I would not be able to work. And I probably would. I talk about this in some of my Held Light platform. I've been to some very dark places in my mind where I just couldn't take it anymore. And if it wasn't for the help I'm getting now through hospice and through Medicaid, I may not be here right now.
And preparation is so important in life. And that's something I can definitely see my husband falling into, because even now, like, he went to Vegas. He left for Vegas today for a week, and his hobby is playing poker.
Nice.
We met in Vegas, so I'm a Vegas girl. I'm just like mad that I couldn't go because my kids, they still got another week of school, so I can't pull them out like when they were little and they have actual commitments and stuff like that. But anyway, before he left, he did all the laundry. He cooked 2 meals, put one away. I mean, he just picks up the slack, and I can see him doing that more and more. And I can see how, if I don't have these discussions with him now, and we don't have planning now, that he could so easily just feel like he has to do it all himself, because that's who he sees himself, as the provider and the doer, and he's always been that.
Sounds like me. But he's gonna break. He can't do that forever. You're gonna fucking break. And I'm speaking from experience. I had complete total mental health breakdowns because I was the guy trying to do it all. We talked about that in the last podcast with the children. Yeah. But if you don't swallow your pride and put your ego aside and admit that you need help, you're gonna break. And you know what? Sometimes you just have to break to realize you needed that help. And so it's so important for the caregivers to just look in the damn mirror and tell yourself you need help and you need a break. And these in-home health companies can do that for you, because you can't do it all. I'm telling you, you can't. I can't do it all. And it's so nice when she gets these folks that take care of her. They're not house. That's one thing I will say. I know we're getting close on time here. They're not your maid. They're not your cook. They're not your butler. They're there to take for your loved one. And I've had a few of them tell me some nightmare stories where they've had some real Karens of or Ken's or Kevin's or whatever the male version of a Karen is, where they think that they're there to clean their house for them and cook and clean and do all this. That's not what they're there to do. They're there to take care of your loved one. But like the one that she has, the two that she has now, like there are times where they can see that I'm just spent. And the other day I came home and like they really cleaned the shit out of the house for me. It felt so good. So they'll go above. Some of them will go above and beyond. But it is nice to just know that, like when I was in Houston recently, to just know that I had her in respite. She's taken care of. She didn't like being there, but she was taken care of. And then when I had to work a late shift last week and I had a few extra hours, I'm like, she's fine. I don't have to. That's the other thing about the folks that are still working full time like I am. I don't have to worry about it like I did before. Before I got all this, I was freaking out at work. I could not focus at work because I'm like, is she okay? Is she going to fall today? And I didn't have the Ring cameras up yet in the house. So I had no idea what I was coming home to. And I would take lunch, run home. Hey, are you okay? And then I'd go back to work. That's not a sustainable lifestyle. And you will, I speak on most of my stuff is caregiver burnout, and I'm fucking living it. And the care that we're getting has helped a lot.
And I do want to, a big part of this purpose of this podcast is to give perspectives from both sides. Mm-hmm. And so I want to put it back also on the person with this disease. Like when you're in that place where you're still, doing well and cognitively fine, and all of this looks very far away, and look, I'm not even really at retirement age or anything like that. This is all stuff that just seems so far down the line for me. But I have a responsibility too to my husband to do the things that I can do, to take responsibility to put in place for what could happen so that he doesn't feel like he has to do it all, and that's what I really need to sit down and get serious about, is like redoing all of that documentation. We had also talked about a trust. I know that's something that, again, you're talking about an elder care lawyer. This is like, a lot of it is just life planning,
Well, estate lawyers, so
estate planning.
Yeah, estate planning. So a lot of the estate lawyers, at least the ones I've talked to in this area, do the same. I say elder care because that's what that guy kind of claimed himself as, but he really is an estate lawyer. So it's a one-stop shop, and they can get expensive. My friend used one. He paid this lawyer a lot of money, and they built the go to hell book. They built everything, and like, all right, here's everything. And then it's also like, hey, if something happens, call this number. And the lawyer's like, I got it all right here. So
yeah, because my husband is forever like, but you're home all day and you're not working. Like you get to do some stuff. I'm like,
yeah.
But I'm a house cat. I'm a trophy wife. What is this doing of the stuff? I'm just here to look pretty, But I
hate to say it, he's gonna have a wake up call.
I have to prioritize it because I give attention to so much other stuff, and I need to like sit down. I have spurts, where it's like I'm very productive at home, and then I crash back on apathy where I'm just like, I'm a baby. I'm not doing anything, and I'm like so spoiled. So like I have to stop doing that because I had worked it all out. Actually, before I got diagnosed, I had sat down and but like I said, things happen. And as a former paramedic and all that stuff, if the things are not readily accessible and everybody's not on the same page about it, things can go south very, very quickly. So it's really important that they get updated. And the best time to update it is for what? New year, new me. We're coming up on the end of the year. So new year, new me. Get your go to health plan together. Get your estate planning. Why? Because we don't want the government to take our money any more than they already do.
Yeah, and who knows how this is going to play out over the I know premiums are changing. Who fucking knows? It's so unpredictable of the future. So take advantage of it now. And if you don't have the money for a lawyer, do a GoFundMe and get the money. People will donate.
And reach out because there are resources. So if you have a primary, I know that people are going to say, oh, I tried this and blah, 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 blah. I'm just telling you how it's supposed to work. Your health insurance you should have access to care coordinators and social workers through them. The problem is your physician has to actually request it on your behalf, and they hate to do it. Usually how you get an in is when the person is hospitalized. So hospitals have to have a social worker for discharge planning purposes because they can't send you home to an unsafe environment. So for a lot of people, that's kind of your first foray into social workers and what they do. But there are avenues, and I really do recommend that people do try and get in touch with state agencies, or like I said, FQHCs, federal qualified health centers. They're good resources, and again, support groups and patient organizations and things like that.
There's that one organization. It's like the area agency on aging, I think. That was the first social worker. She said, "Do this." Let me just search it real quick. I'm sorry. There's an organization that helps, and of course, now that I want to search it, I can't find it. Oh yeah, it's the Area Agency on Aging, AAA. What it is, it's the Area Agency on Aging is a regional state-funded hub created under the Older Americans Act, and you can do this when you're younger. That one of the social workers told me, go here. And I did. I called them like, oh, this is great. And then they're like, yeah, what the other lady told you to do with the lawyers is better if you can afford it. And I'm in Florida, so it's Area Agency on Aging, Aging and Disability Resource Center. Basically, I just Googled this. So if you're watching or you're listening, and you have questions, Google Area Agency on Aging for your state and your county, and it'll take you right where you need to be. I've had a couple of people ask me over the years that have known me, like, how did you get what you got? I go, because I didn't fucking give up. I didn't take no for an answer. I literally, at my lowest point, was cold calling nursing homes because I knew that social workers were the way to go, and I knew that the high-end nursing homes was going to have high-end social workers, and I knew one of them would eventually. And by the way, if that one hadn't answered the phone, my next step was I was just going to start showing up at their door. And hey, I need to talk to your social worker. Who are you? I'm interested in bringing my loved one here. And then just like, don't quit. Quitting is not the answer in this case. So that's how I got to where I am.
Persistence is key, and squeaky wheel gets the grease. And it's always, we have to advocate for ourselves and our loved ones. Unfortunately, nobody's ever going to care about us as much as we care for those that we love. I mean, that's just human nature, but you meet a lot of amazing people along the way. And I'm always surprised at the kindness of strangers and how much people are willing to help if you're, really persistent and vulnerable and honest with your journey, because we're all care partners at the end of the day. And so I've just encountered so many people that are so understanding and helpful when you're just really honest and straightforward about things, and don't be mean though.
I can't promise you that I'm not going to be mean.
You catch more flies with honey than with vinegar.
I've been very persistent with some folks, and sometimes I come off as an asshole, and it's not that I'm being an asshole. It's just like, I want the right answer. And if that's not it, so I'll just say this before we wrap up. She was with a different hospice agency before, and there was a medical decision made that I knew was not appropriate. And I asked to speak with the physician, and I never got to the physician. And I ended up talking to a middleman that was an administrator, not a provider. And I said, "You're not a provider." Because I'm like, who are you? And I got whatever they were. And they were like, the administrator. I'm like, you're not a doctor. You're not a nurse. You're not a PA. You're not a provider. I want to talk to the provider. And anyway, so I just kept going up the food chain. I won't say the name of the company, but I found out who the CEO was, and I got their email and I got their office number, and I called them. And I was like, dude, why did your doctor make this decision on this particular medication that would have been detrimental to the outcome? And here is where cold turkey stopping them on that could have killed my wife. And anyway, they dropped me. And I am glad they did, because the company we're with now is phenomenal organization. So I'll close with that. You're right. Don't be a dick, but also don't take no for an answer when you know the answer you're getting is bullshit.
Yeah. And I am guilty of being a quote unquote Karen, because I am a very big proponent of the That's great. Can I speak to your manager?
We covered a lot. I think this was good. I know we wanted to talk intimacy. Maybe that's another day. But this is a good one because it's fresh in my head because we're actually supposed to renew in 2 months anyway. And I think there's a lot of people that just don't know that these systems are in place and they don't know how to navigate it. And I will close with the same disclaimer. Like, every state is different. I'm in the state of Florida, and apparently Florida is one of the better states when it comes to this stuff. I know I spoke with somebody once before based on a TikTok or something I did on one of my other platforms. They're like, hey, I want to say they were in West Virginia, and not every state's funded the same. Not every state has the same policies. And for those people, I'm sorry that you're going through that, but I will go back to that using AI to help you, using just search. Everybody has a phone in their pocket, and that phone's connected to the internet. Be persistent and search, or do what I did. Just find a damn social worker. If you have a loved one that's getting health care, then that company that's caring for your loved one has a social worker. Just ask questions.
Yeah, definitely. And I just want to remind everyone, we're doing this for you guys. This could have literally been just a text message thread with Brent and I, but we decided to do this for the benefit of other people. And so we really appreciate any feedback, and we hope that you will subscribe to the channel so that when new videos come out, you'll know first, but also hit the like and comment and about the things that you want us to talk about. But we are not social workers. We are not doctors. We are not therapists in any way, shape, or form qualified to answer all of your questions. But we hope that we can all learn from each other and benefit from other people's experiences and successes. So share your successes as well as your failures.
Yeah, I like that. I'm just a dude going through shit, and she's some chick that's got the Parkinson's.
And I literally put my dress on backwards again going into this.
I know. I should have recorded that. I should have recorded that.
Do not trust a girl.
She had to go off camera. She had to go off camera to fix her dress to come
consistently. All right. Thank you.
Thank you, everybody. We'll see you next time.